It is the fifth most common type of cancer in the UK. It can affect both adults and children at any age. Fatigue is the most common physical condition of lymphoma, regardless of subtype. So, what are the other symptoms of lymphoma? Let's see in this video. These are 5 signs and symptoms of lymphoma. Lymphoma develops when white blood cells called lymphocytes grow out of control. Lymphocytes are part of your immune system, which helps to fight infection. Lymphocytes travel around your body in the lymphatic system carrying a fluid called lymph. The lymph fluid passes through glands, lymph nodes, which are spread throughout your body. For this reason, lymphoma might also be referred to as a cancer of the immune system. Lymphoma can be challenging to diagnose in its early stages. Early symptoms may be either non-existent or fairly mild. Symptoms of lymphoma are also nonspecific. Common symptoms are easily overlooked or ignored. The first symptom of lymphoma is fatigue. Fatigue as well as the lack of energy and interest can be symptoms of lymphoma. However, fatigue can also be a sign of insufficient sleep or poor diet. Persistent fatigue is something you should talk to your doctor about. Even if it's not caused by lymphoma, it may be a sign of another condition needing treatment. It's estimated that almost everyone with cancer will experience fatigue. It's considered the most common symptom of lymphoma. Depending on the individual, fatigue can be mild or severe. Night sweats, chills, and fever. Fever is a natural response to an infection, but it may also be a sign of advanced lymphoma. Most lymphoma-related fevers are relatively low grade. They're often accompanied by chills. Night sweats may occur if you have a fever while asleep. Intense night sweats associated with lymphoma can cause you to wake up to soaking wet sheets. Excessive sweating can sometimes occur during the day as well. You should tell your doctor about any unexplained fevers that come and go for 2 weeks, repeatedly. They can be a sign of lymphoma. Unexplained weight loss. Sudden, unexplained weight loss of 10% or more of your body weight may be a sign of lymphoma. Like other lymphoma symptoms, this may also be caused by other medical conditions. With lymphoma, cancer cells can burn up more of your body's energy resources while your body tries to fight these cells off. This can lead to sudden weight loss, especially since many lymphomas typically grow quickly. You should discuss any extensive and unintentional weight loss with your doctor. It can be a sign of a serious health problem. If you lose 5% of your body weight in a month, or 10% within 6 months, make an appointment to see your doctor. Rash and itching. Lymphoma can sometimes cause an itchy rash. Rashes are most commonly seen in lymphomas of the skin. They may appear as reddish or purple scaly areas. These rashes often occur in skin folds and can be easily confused with other conditions like eczema. They can spread as it progresses. Lymphoma can also form lumps or nodules within the skin. About 1/3 of people with Hodgkin's lymphoma will experience itching. However, it's less common in those with non-Hodgkin's lymphoma. Itching can occur without rashes. It's believed that chemicals called cytokines, which are released to fight cancer cells, contribute to making the skin itch. If any rash does not resolve on its own after 2 weeks, you should see your doctor for further evaluation. Chest pain or lower back pain. The thymus is a small, 2-lobed organ located behind your sternum and between the lungs. It's part of your immune system. Occasionally, lymphoma affects the thymus gland, which can cause chest pain. Rarely, lymphoma affects lymph nodes located in the lower back. Swelling there may put pressure on the nerves of the spinal cord. However, there are many more likely causes of lower back pain than lymphoma. You should contact your doctor about any persistent pain anywhere on your body. In conclusion, lymphoma is a serious condition that requires prompt medical attention. If you're experiencing symptoms that resemble lymphoma, your doctor will run tests to determine the underlying cause. If you have lymphoma, your doctor will diagnose the condition and then determine how advanced it is. They might run preliminary blood tests to look for abnormalities, including abnormal red and white blood cell counts. If you have enlarged lymph nodes, they're also likely to take a tissue sample or biopsy from the lymph node to look for cancer cells. If your doctor suspects that lymphoma has spread or might be present in your bone marrow, they may order a bone marrow biopsy. This procedure is done under local anesthesia. Bone marrow is taken from within the bone by a hollow needle. Your doctor may also use the following tests to get an internal view of your chest, abdomen, or pelvis. Like ultrasound, CT scan, PET scan, and MRI. These tests will help your doctor look for abnormal lymph nodes and tumors and allow them to evaluate the condition of organs and tissue.